Hello everybody, I'm Ben Hannigan. I'm a mental health nursing professor working in the School of Healthcare Sciences at Cardiff University. I'm going to say a few words about the mental health nursing workforce specifically. I'm going to begin with some observations on the characteristics of the workforce across the whole of the UK. And of course we're a little bit unusual, I think, in the UK in continuing to prepare and recognise nurses for practice in specific fields. So mental health nurses are prepared for mental health work. In their initial education, they register and join the workforce as members of the largest professional group contributing to mental health care and treatment. And there's some support from an international review conducted by colleagues at King's College London for this distinct field-specific approach to pre-registration education. And if we look at this graph on the right, so this is a graph that I've created drawing on Nursing and Midwifery Council data. It records the numbers of nurses across all 4 countries of the UK registered to work in the mental health field, which of course is different from the numbers of nurses actually working in mental health settings. But in terms of the numbers of mental health nursing registrants, there's a very alarming dip, isn't there? That it's very clearly possible to see from 2014 to March 2018, but a very welcome increase in the numbers of mental health nurse registrants. So that when the NMC published its last set of data in March of this year, that number had gone up to above 90,000. And reflecting their numbers, the quantity, the numbers of mental health nurses working in mental health services, it's entirely the case that mental health nurses are found almost everywhere where formal mental health care is organised and provided. And if we look at government-sponsored and independent reviews of the work and the practice and the values of mental health nurses, we'll find strong support for what mental health nurses do. We'll see it in the Department of Health From Values to Action report, and more recently in the Foundation of Nursing Studies Playing Our Part review, a review led by Professor Tony Butterworth that reinforced the case for graduate qualified mental health nurses. And we know that what mental health nurses are particularly valued for is they're skilled, they're person-centered, they're psychosocial care, and very importantly, but often overlooked, I think, the coordinating or the organizing work that mental health nurses do. They will bring people to the system and they will bring the system to people. And beyond the level of initial registration, we know that many, very many mental health nurses have developed significant post-qualification knowledge and expertise. They will often have that advanced knowledge and expertise recognised through higher awards. There's new interest currently in advanced and specialist practice. This screenshot on the right is from the Nursing and Midwifery Council's newly launched programme of work on specialist practice, which includes specialist practice in community mental health nursing. And many mental health nurses we know are in positions of responsibility, significant responsibility. They lead interdisciplinary services. Mental health nurses act as independent consultants. They are advanced clinical specialists. Some are educators and or researchers, and the roles that mental health nurses occupy in relatively recent years has significantly opened up. So it's possible now to be a mental health nurse in practice who prescribes independently medication, and it's possible to be a mental health nurse who is also an approved mental health professional or is a responsible clinician. And interestingly, we also know that in the context of the COVID-19 crisis, people have become interested, more and more people have become interested in careers in nursing. So UCAS, the University Admissions Service, reports that there has been in the context of the coronavirus crisis, a 15% increase in applications for undergraduate nursing courses across all fields. NHS England, in its recent workforce plan, reports that applications specifically for mental health nursing degrees have increased in the context of the coronavirus crisis by 32%. And this graph that I've extracted from June the 30th, 2020 UCAS data shows very clearly how more and more people are, in recent years, are applying to nursing degrees. There having previously been a very significant dip in the numbers applying that you can see in 2016, 2017, linked of course to the introduction of fees for students in England. So what do we know about mental health nursing in Wales specifically? Well, I'm linking this talk to the draft workforce strategy for the health and social care workforce that was produced at the end of 2019 in support of a healthier Wales. And when I look at that draft health and social care workforce strategy, I see a promise to develop across a 10-year period a motivated, I'm quoting here, a motivated, engaged and valued health and social care workforce with the capacity, competence and confidence to meet the needs of the people of Wales. And in and amongst the 32 actions in the workforce strategy, action 10 specifically relates to the mental health workforce and the plan to develop a workforce in support of the implementation of Together for Mental Health, which continues to be the higher level strategy or policy for mental health care in Wales. Here's some data about the characteristics of the mental health nursing workforce here specifically in Wales. So we don't know, to the best of my knowledge, what mental health nursing vacancies there are in NHS Wales, because neither Welsh Government nor NHS Wales publishes those data. But we do know from Nursing and Midwifery Council reports how many nurses in Wales are registered in the mental health field of practice, which of course is not the same as saying this is how many mental health nurses are practicing in the mental health area or in mental health settings in Wales. But we can see a steady and welcome increase in the numbers of registered mental health nurses, so that in March 2020, which is when the NMC's most recent data were published, there are heading towards 51 or just over even 51,000 mental health nurses registered. A little bit more detail here from Stats Wales, the Stats Wales website, which actually reports on the numbers of mental health nurses practicing in NHS Wales. So that's a lower figure, obviously, than the figure in the previous graph. But this reports a fairly, if you look at the top level here, the light blue line, a slight increase perhaps, but a largely steady mental health nursing workforce in NHS Wales over the last 10 years. There are now around 3,100 registered mental health nurses working specifically in NHS Wales. And mental health nursing in Wales is, of course, undertaken in a very distinct policy and practice context. We have distinct legislation around sustainability. Wales led on safe staffing. We have the Mental Health Wales measure, which is a specific piece of legislation which addresses access to mental health care, care planning and care coordination. And mental health nurses in Wales, through the All Wales Senior Nurse Advisory Group, have also produced a framework for mental health nursing in Wales. And it seems to me that if we are looking for some starting principles or some premises on which to develop a workforce strategy for mental health nursing in Wales, we could do a lot worse than look at the framework's workforce education and research section. And this talks about the importance of improving retention. The framework talks about the importance of promoting continuous education and training. The framework talks too about the development of career pathways a specific example that I would give are clinical academic career pathways, which nursing, mental health nursing included, seems to have struggled to create over the years. The framework talks about supporting nurse-led services, encouraging nurses to fulfill new roles, including those that have come about through the mental health changes to the Mental Health Act. There is talk too on enabling nurses to grow their therapy skills, and finally to increase research capacity within the profession. It seems to me that those are as good a set of places as any to think about the mental health nursing contribution, particularly to the mental health workforce, and to a strategy for that. And at that point, I will thank you for listening and wish you well.